Endometrial cancer is a cancer that begins in the uterus. Now, the uterus is the hollow, pear-shaped organ where the baby actually develops. It begins in the cells that actually comprise the lining of the uterus. Now, it is sometimes referred to as uterine cancer. However, there are other types of uterine cancer, namely uterine sarcoma. However, these are not as common as endometrial cancer. One good thing about it is that it can be caught at an early stage because it actually produces abnormal vaginal bleeding, which prompts a woman to seek consultation. Now, if treated or if caught early and treated immediately through hysterectomy, then endometrial cancer can actually be cured. The signs and symptoms of endometrial cancer are the following: postmenopausal bleeding, intermenstrual bleeding, and pelvic pain. So when do you see your doctor? Call your doctor or set an appointment if you experience persistent signs and symptoms of vaginal bleeding and pelvic pain. Up to this time, we still don't know what causes endometrial cancer. However, there are several risk factors that can be identified that may increase your risk of developing the disease. Number 1, fluctuations in the balance of both your estrogen and progesterone may cause changes in the endometrium. Any disease or condition that increase your estrogen and not your progesterone may increase your risk of developing endometrial cancer. Examples of conditions and diseases are polycystic ovarian syndrome, obesity, diabetes, and using estrogen-only hormone replacement. Number 2, having more years of menstruation, meaning getting your menses earlier or actually being menopause at a later age. Having a positive history of colon cancer also increases your risk, as well as being obese, getting older, and not getting pregnant at all. And finally, if you've had a history of breast cancer, using tamoxifen can actually also put you at risk in developing endometrial cancer. So how do we prevent developing endometrial cancer? A healthy lifestyle and getting checked regularly is very, very important. Certain studies have also shown that taking birth control pills can decrease your risk. Treatment options actually comprise of surgery and medical management, depending on the assessment of your doctor. At the end of the day, knowing your body, knowing when something is not functioning properly, and seeking consult right away may actually help you catch any disease entity at its early stage.